Hello, and welcome to the In-Network podcast feature, Designing for Health. I'm Nordic's Chief Medical Officer, Dr. Craig Joseph. Today, I'm joined by Robert Slepin, a healthcare technology executive whose career spanned vendor organizations, health systems, digital transformation leadership, and now the Chief Digital Officer role at a major Canadian home and community care organization. In this episode, we explore why large healthcare transformation projects rarely unfold exactly as planned, and why that's not necessarily a problem. Robert shares practical lessons on adaptability, continuous learning, governance, and the importance of defining what good looks like before launching major initiatives. We also dive into AI strategy, including how healthcare organizations can balance innovation with responsible governance, manage the flood of AI use cases, and prepare for a future where electronic health records may look very different than they do today. If you're a healthcare leader trying to navigate digital transformation without succumbing to either hype or despair, this conversation is for you. Let's plug in. Robert Slepin, welcome to the podcast. How are you this fine day?
Great, Craig. Thank you so much for hosting me.
I'm excited to have you. You have I know you were denying that this before we started recording, that you've had a long and storied career. I think you said maybe it's long, but it's not that storied. I think it's storied. So why don't you, instead of me trying to summarize it, why don't you kind of tell us about your career, maybe start in third grade?
Yeah, I was going to start in seventh grade. That way, we've only got about 30 minutes, and I don't want to go over the limit, Craig. But seriously, it is a long career. And I suppose you're right, because I do have a lot of stories to tell. So if that's the definition of storied, I've been really lucky to be in healthcare IT for most of my career. I started on the vendor side, actually, working for a hospital information systems company. It was called Management Systems Associates, or MSA. I worked there for 5 years in a variety of roles. Incredible company that eventually was bought Allscripts and became part of that journey. But they'd been in business for a few decades and had provided full HIS systems to small and mid-sized hospitals in the States. It was a really wonderful learning opportunity. And while I was there, I interacted with many data processing and MIS directors, is what they were called, or information systems directors in hospitals. And I just really loved their job and their work. And I had a passion for being on the provider side. So I was lucky enough to get an opportunity and pivoted my career to the healthcare CIO side for about 20 years. And after doing that for a couple of decades, I decided to pivot again when I was CIO for an integrated delivery network that was acquired by a larger neighboring network. I did some soul searching and decided, you know what, this is a lot of fun. I think I'm going to focus on transformation program leadership. So I was lucky enough to get a job as a program director and did that kind of work, program leadership and advisory work for mostly clinical, but also business transformation projects for the next 10 years. And then about a year and a half ago, I pivoted back into the Chief Digital Officer chair here at SC Health. It's been a lot of fun. I've worked in integrated delivery network, academic medical center environments, population health management, disease management, and payer settings. I've had international experience in the US, Middle East, and for the past 9 years in Canada, I've worked with Johns Hopkins Medicine International, Stanford Health, Sutter Health, University Health Network, and the Hospital for Sick Children in Toronto, Alberta Health Services, and more. For the last 8 years, I've been doing board advisory roles as part of my work. And SC Health was a client of mine, and an opportunity came open about a year and a half ago for the Chief Digital Officer role, and I came on board.
I'm really going to push on you about this storied. That's a pretty storied career. Obviously, most of us have never heard of any of those names that you just mentioned, organizations. So they're clearly all small and not a big deal. But yeah, that's like you have been there and done that and gotten the T-shirts all across the world in all kinds of different settings. Tell us a little bit more about where you are now, SE Health. What do you do there?
Sure. So my role here is as Chief Digital Officer is it's kind of like the UHN of home and community care in Canada. So not all of your listeners may be familiar with UHN or University Health Network in Toronto. It's Canada's top hospital, recently ranked number 2 in the world by Newsweek, an outstanding academic health sciences center where I was lucky enough to work for 5 years before coming here to SE Health. But SE Health is a lot like them in that we are not just a care provider, but we're also have a learning institute and a research institute. And we're quite diversified in our different aspects of reaching home and community care across Canada. We're not for profit. We deliver nursing, personal support, therapy, and care management services. We visit more than 25,000 people a day in their homes. We own and operate small care homes. We serve as an operator for larger care homes. We operate 2 hospices in Ontario. We have 2 telehealth triage centers in addition to research and learning institutes. So very exciting, highly innovative organization with a proud history of 118 years. We're embarking upon a very significant digital transformation, which is what brought me here.
Yeah. Well, it sounds like it's perfect for you, given your experiences on the vendor side, the provider side, essentially consulting side. So that's terrific. All right. Well, let's kind of get into some of the things that you have learned. When we were preparing for this call, you said something that I just loved, and it sounds pretty obvious, but I don't think it is. He said a lot of the things don't work out the way we think they will. Now, your career might be one of those, right? Like I'm pretty sure in 7th grade, that's as far back as we wanted to go. You really didn't perceive or contemplate this kind of a career. What are some of the projects or work that you've done that reality was different than your expectations?
Yeah, thank you, Craig. It's such a great question. And truthfully, no project that I've worked on has gone the way I or others expected. Zero.
Okay. All right.
Now, I would say that most of them actually ended up close to where we thought, not exactly, right? It's when you're looking 1 or 2 years out into the future and you're working on a large, complex project in a healthcare context, the extraordinary complexity, uncertainty, ambiguity, and volatility of the environment pretty much guarantees that things aren't going to work out exactly the way you planned. So you've got to do your best to learn and adjust all along the way. So I've got lots of examples of projects that didn't work out the way we thought we would, but it's pretty much everyone.
So are there any that kind of stand out as a particular learning for you where like, boy, I won't do this again, or I really didn't want to do this, but I was convinced that I had to do it. And boy, that was a great idea.
Yeah. I think, again, each project that I tackle, each has patterns that are very similar to the previous one, but they're all unique and such that each time you go through kind of a roller coaster in terms of being very excited when you get started, and then things get moving and you find that it's harder than you thought it would be, and there's a dip, and then you recover, and then there's a big celebration in the end. There is there is one not too many years ago. There was an ERP project implementing a finance and supply chain program that was extraordinarily complex for an academic medical center. And predictably, it got off to a bang. It was working with a major global software supplier and a systems integrator. We assembled a team. We had, everyone was very excited. And within months of getting started, the project started drifting from green to yellow to red. And it had a lot of dependencies on third parties. There was a dependency on a systems integrator for data migration, which was very challenging. There was a dependency on a third party for warehousing for the supply chain that was challenged. There was a dependency on a systems integrator that, wasn't completely meeting expectations. There was dependency on internal staff that were learning along the way. So it was, extremely complex. What we were trying to do, we were the second hospital in the world to attempt to implement this particular software. And there was a lot of customization required to the supply chain. So it really checked a lot of boxes for extremely high risk environment. So not unexpectedly, the unexpected happened and we needed to respond and we did. And management responded, the team responded, and we got the situation under control. The project ended on schedule, within budget, and we kept patients safe through the transition. And I'd say most of the expectations were met. There was a few misses. That's pretty typical, but the project was considered overall a big success.
The key lesson there seems to be flexibility and also kind of understanding, something that I've said that, which is in no way sophisticated, but you kind of said it in a lot more sophisticated way than I often say that no matter what you do, it's not going to work. And so you should just accept that, or it's not going to work as well as you wanted it to, and just expect that that's going to happen and then pivot when you can. And I think that's the same thing in a more sophisticated way that you were talking about. Hey, we knew it wasn't going to be perfect. We ran into some problems, and then we were able to overcome those problems and get back on track. But that wasn't a surprising thing. That was an expected thing.
Yeah, Craig, if to your point, you're right, flexibility, adaptability. So recognizing the hospitals and healthcare organizations are extraordinarily complex by their very nature. And so therefore, any kind of transformation project or program inherently inherits that complexity. So
Sure.
how could we possibly expect not to need to adapt and learn, adjust along the way? And I think that mindset is critical. It's a learning and adaptive mindset. And I think what really made that come alive for me have been a student of the Toyota management system of lean and quality management frameworks for many, many years. And at one point I had a coach and a mentor who was really one of the leading thinkers in the lean IT movement in the world. And we were working together on a large EHR project. And I brought him in to coach my team and help us develop a daily management system and other practices to be able to hardwire quality into the project, right? Our health system at the time was on a lean journey, and we were bringing lean into IT and into the Epic project as part of our practice. And he said that every single step and every single activity on the project plan was a PDCA cycle, plan, do, check, adjust, or the short cycle of continuous learning that those of us who are, familiar with quality frameworks would recognize. And it's very popular in healthcare quality circles. And that really blew my mind. And when I thought that I had a background in IT operations and IT program and project management, but to really think that every single step along the way is a learning cycle was kind of mind-boggling, because when you start one of these projects, you have a scope, you have a schedule, you have a budget, you write a project charter, get the team together, and you kick it off. There's a lot of assumptions that, hey, this is the plan. You got to stick to the plan. You got to hit the date. We got to meet the scope. But how could you possibly start a 1 or 2 year or longer program of that complexity and expect to perfectly hit the schedule, the scope, and the budget with no adjustment? It's not possible. So therefore, you've got to be realistic. It doesn't mean you don't aim very high for that perfect vision, but you have to be able to recognize that you're learning and adjusting every single moment, every day. And if you can develop that mindset throughout the project team, you have a much better chance of learning and adapting and being resilient along the way, and then plowing those learnings into the next steps so that you can identify, evaluate, mitigate the risks, optimize use of your resources, learn and improve your process as you go along. And that way you will optimize the outcomes. You have a much better chance of actually being on schedule, preserving that scope, and coming in on budget. You might need to use some contingency, but certainly above all else, maintaining a line on quality and safety, which is crucial in a healthcare context, because rule number one is do no harm. And while it's okay to move fast and break things in a many non-healthcare contexts, in a healthcare setting, we have to first of all look at the patient and the people taking care of them, make sure that they're safe and we're effective in meeting their needs to honor our mission and our sacred obligations.
I love it. I have never, like you, kind of thought of every line on a project plan as being a little PDSA kind of activity, but it makes complete sense. And when you look at it from that standpoint, if everyone kind of went in with that attitude, you'd have a lot less heartache as you're going through the project. When we were talking to prepare for this conversation, one of the things I brought up was a chapter in the book about stupid stuff. And I'm allowed to say stupid. Some organizations call it silly stuff, but either way, you get the point. And you had mentioned that you thought a lot of the things that you encounter in a large organization, be it healthcare or not, that doesn't make any sense. So a lot of those things are come down to ultimately a lack of clarity. And so I'd love to talk about why you think that is the case. Why is a lack of clarity difficult to achieve, even in some organizations with lots of very, very smart people, and they still end up doing, in retrospect, stuff that really didn't make a lot of sense?
If I knew the exact answer to that question, I would probably write a book. I think somebody else probably actually has. There's been a lot of books on this topic, but it is,
Sure.
I do think that the most outstanding people that I've worked with and teams and organizations really get the importance of clarity, and they are clearer in their thinking and their communication. And it's I think of one of the key characteristics of high performance. So why is it hard to achieve? You're right. I see so many smart, well-intentioned, highly skilled people not always being clear. I'm not sure there's always a common understanding of even what it means to be clear. Like, what are we talking about, right? So I took a computer science class, one of many early in my journey, and systems analysis and design on my road to this career. And I remember just was emblazoned upon my mind about clarity of requirements, right? Which we were learning in systems analysis, which is being specific, clear, and unambiguous. So that was the three adjectives that the instructor drilled into me. And I continue to refer to it, and I bring it up continually with colleagues that I work with, because I think even when people are thinking clearly, they're not necessarily communicating clearly. So it's probably more a failure of communication, which starts with, but it's throughout the whole team. So we need to, if we can all share a common understanding of what it means to be clear, and then anchor on that, and then I think we need to train our staff. We need to set a good example. We need to live it, and we need to hold each other accountable. So constantly what I'm doing to help people understand what I think it means to be clear, whether it's anyone I'm working with, and try to bring that into our work so that we are communicating clearly with each other. So we have a common direction. We know what problems we're solving, and what good looks like if we solve that problem. So that's part of it is communication. I think it's more than that, but I think that's a key aspect of it.
Yeah, I want to put an exclamation mark after that. Your comment about what does good look like. I think that I've seen that over and over again be a problem. Like we maybe agree on where we want to go and why, but what does good look like, so that we can then judge if we got there, and how to know when to stop, right? We're not seeking perfection. If we are, that's a great thing to seek, but realize that you're not going to get there. What does good look like? And if you can define that and we all can agree on that, then it's much easier to know when we've got there. So I love it. So let's pivot a little bit to some stuff that's going on now. There's this thing called AI. Have you heard of this?
Somebody mentioned it.
Yeah, they have it up there in Canada. Let's talk about AI and SE Health. Like, what are you all trying? What does your path look like with regard to incorporating artificial intelligence into the healthcare that you provide for patients and the people who take care of them?
We are, first of all, taking a step back, like any healthcare organization, probably anywhere in Canada or elsewhere, we're facing common challenges with access to care, quality of care, affordability, equity, burnout, concerns about our workforce, right? So wanting to shift from a sick care system to more of a healthcare system, wanting to shift more left upstream from, treatment to prevention. We're feeling a strong sense of responsibility to advance the health and well-being for all Canadians. And we recognize that the home and community, this is where people live. This is where people are. And this is where we meet them. And this is our responsibility is to help people well, living at home, aging at home, and taking care of our caregivers as well. We cannot accomplish our bold vision and mission if we keep on doing things the way we always have, right? There's so many great things about our healthcare system and about the technology that we use in our processes, but there's a lot that's broken or in need of redesign or improvement. And AI is a thing. It is what it is. It's a new, some would call it, not everyone would agree. It's a new form of intelligence, but I think most people, it is artificial intelligence. So let's say it is. And we need to recognize that and embrace it. And we are doing that head on in a safe and responsible way. So we are aiming to really understand what is the art of the possible. What are the opportunities for us to, leverage AI to achieve our objectives, but what are the risks and how do we proceed? Because it is a high opportunity environment, incredible opportunity, right? But it's also very high risk. So we are proceeding very intentionally. And we have certainly we're early in our journey and we are taking steps to be able to be very, very deliberate, very intentional, very strategic. AI is one of our strategic enterprise priorities. And we have an AI strategy. We have an annual plan for the year. We have set up a governance structure. We've set up a sandbox. We've brainstormed hundreds of potential use cases. We currently have more than a dozen in our sandbox.
Okay.
We have some that are getting ready to go out into production pilot. We have established an ethical framework, AI and ethical principles. We've established a community of practice. And like many hospitals and healthcare organizations, we've rolled out, basic tools like Microsoft. In our case, Microsoft Copilot is our first tool for many of our users.
Mm-hmm.
And we're, focusing more in administrative use cases, which are safer. We're certainly working the sandbox on clinical use cases. We're very, very excited and looking forward to next steps.
Let's focus a little bit on governance. How does, or maybe it doesn't, how does AI governance differ from kind of the IT governance that you might have been doing for the last 20 years? Do you see a divergence there?
We have talked a lot about this. And actually, when we started our journey about 14 months ago, right after I started in this role, we formed an AI governance group that I co-chair with our chief legal and privacy officer and our senior vice president for social impact and global initiatives. And she's also responsible for our solutions lab. So we intentionally set up a separate governance group to get started to focus on AI because of its high potential and also high risk in its nuances.
Mm-hmm.
But we quickly recognized that there's so much overlap with IT governance that we started integrating it, bringing it together. And one of the conversations that my co-sponsors had with me, they said, why do we have a separate intake process from the IT intake? And I said, you're right. Let's bring it together. We happened at the time to be redesigning our intake process for IT. So we had just finished that and we used that as an opportunity to then integrate AI. And what we found is that 80 to 90% the same, but there are nuances with AI where there are questions that need to be asked and, different nuances that needed to be adjusted to be able to accommodate for AI. But bottom line is we brought it into our IT governance and also to our enterprise business governance. So we're reporting to the full senior leadership team and the AI strategies enterprise priority. So the full senior leadership team are key stakeholders in it and are overseeing our work.
So you mentioned kind of the intake process. Are you getting pushed by your users to, hey, to start a specific application or a company that's been advertising? Are you, and if so, is that coming from the administrative side or more from the clinical side? Is someone banging on your door, and if so, who and what do they want? That's what I want to know.
Yeah, that's a really good point. So when we first started our AI governance and set up this whole approach and new process, there were a lot of people banging on various doors with bright shiny object vendors, solutions, a lot of it. And it was kind of a wild west. And people were going off and buying stuff, installing stuff, using stuff. And we could see that, hey, we need to respond to this. We cannot ignore it. It's happening. So, people are using AI in their personal life and it's easy for them to use it in their business life. So we got to get ahead of this. So by establishing a policy, ethics principles, acceptable use principles, by educating everyone in this, by co-creating these principles and policies with the rest of our senior leadership team and setting up the sandbox and acknowledging the demand and creating guardrails and providing education, frankly, by engaging the entire senior leadership team, the noise died down. Not the interest and enthusiasm didn't die. It's only increased. But instead, we created a mechanism where people felt heard. They understood our direction. They could see what the guardrails were. They understood them. We delivered Microsoft Copilot. So there was a tool that was within the safe zone, secure zone with principles about how to use it and how not to use it. And we also asked we decided as a senior leadership team that we were going to focus on several areas first. Legal privacy and compliance was one, HR and education was another, and a couple other areas. And we brainstormed and we asked for the top 3 use cases for each or more. We started with 3, but we got more from some of them. And we invited stakeholders to come into our community of practice, meet with the sponsors. And we had an intake forum and a process, and we had privacy at the table, security at the table, legal, compliance. And we said it will be the business divisions will be making the decisions to prioritize their use cases. We won't be, IT's not making any business decisions,
Sure.
but we are creating the capability for us to work together so that we can help you to explore and experiment, innovate safely and responsibly. So we got a very good reception to that. Is it as fast as everybody wants? No, but we do have everybody. We are really not getting people knocking on my door every week and saying, hey, I want to install X. Now they understand there's a process And there's a requirement for an executive business sponsor for every request. So what we're trying to do is put the ownership, the responsibility, and accountability where it belongs in the business. So every senior vice president can meet with their teams and talk with them about all their great ideas, and recognizing we have limited resources in the company. We don't have unlimited dollars or capacity. We're going through a very large business digital transformation right now. We have a very full plate. Yes, we will make time and resources available for high promising, AI use cases where we can learn and increase operational efficiency and have an opportunity also for aiming for transformational change. So we've got a portfolio of use cases that are, productivity, ROI, transformation, right? All intentionally curated by the business executives. And then we just provide the framework, tools, templates, the guidance, the coaching, and supports to be able to take them from idea to sandbox experiment into pilot and then production scaling. So that's so far, about 13 months in. It's early, and I will not say we're perfect, but I'm happy that with the start we've gotten off to, with the strong engagement, the clarity of direction, the disciplined approach that people are taking, and the focus and prioritization on use cases that are most promising, that align with our principles and values.
So let me kind of take this conversation and fast forward to 5 or 10 years from now. Are there still going to be electronic health records, or are they going to be vibe coded out of existence by a family physician over the weekend? And the answer that you cannot give is it's complicated.
Well, you took away my answer.
I know.
So I'll give you another one. I'll say the answer is yes and yes.
Okay.
So by that, what I mean is it's happening now where there are very talented developers, some of whom who are clinicians that are vibe coding now and aiming to replace the EHR as we know it. And I think they'll be successful. I believe they will be successful in their environment, right? It depends on the context, right? So if you are a physician who has become trained in AI and product, and you're head of product for a startup, early stage company, and you want to vibe code an replacement of an EHR core for your company, and you're inventing a new care model that's all virtual first, let's say, or virtual only, I don't see why you can't do that. I don't think, you still likely are going to need to hook your vibe coded solution onto, I bet you're going to be hooking it on traditional infrastructure, which may or may not include a traditional EHR, up to you. I think you're still going to need a system of record somewhere.
Mm-hmm.
So up to you what you want that to look like. On the other hand, I can't imagine it 5 years from now that we're going to see that same solution at University Health Network in Toronto, or Johns Hopkins Hospital in Baltimore, or the Mayo Clinic in Rochester. I can't imagine 5 years from now that the decades of hard work from so many people across the world collaborating to create these incredible, not imperfect, but really incredible EHRs that are accomplishing so much good. Again, I'm not saying that they're perfect, but they are serving a purpose. And I think what is more likely to happen is those EHR providers are embracing AI, and they're going to reinvent and redesign and improve themselves, as they already are. And they're going to respond, and they're going to evolve. And, so I think that's happening. At the same time, look, 5 years from now, with the power of the technology and how rapidly it's advancing, I could see that there could be a commercially viable, one or more commercially viable EHR platforms that was built from scratch with vibe coding as the prototyping mechanism. I don't think it's going to vibe code into production.
Sure.
But absolutely. I mean, what modern development firm today isn't using AI to the max to be able to do prototyping and to go be more efficient and faster with coding? So it's yes and it's not either or, it's both. I don't think it's one or the other. I think they're both gonna live.
So I'll summarize that as it's complicated, but it was good. I think I think you're right. I think you're right. 5 or 10 years from now, it's hard to imagine things not changing. Maybe not being upside down, but being changed significantly.
But I think they're going to be certain. Electronic health record means different is a big thing, and it depends on how you define it. Like I would argue, for example, that a system like Epic is no longer just an electronic health record. It is so much more. And Judy Faulkner years ago was calling it a comprehensive health record. I'm not sure what she calls it today, but it's a community, it's a platform, it's an ecosystem. I do think that, there's a vision that we're not even going to need software anymore, and it's just vibe coding on the fly. And I can imagine that we'll see, a very different kind of software in the future, more and more with agentic AI. And agents will be, will replace the traditional software. So obviously that's changing rapidly.
Yeah.
It'll be part of the story.
I love it. I'm here for it. I'll be watching with you to see how things change. And hopefully in the near future, I'll be replaced by an agent. And we'll be able to get more done. I'm slowing us down.
Well, I think a digital twin could be in your future.
There we go.
I don't see why not.
There we go. I feel it's not good for society to have a digital twin of me, but we can talk about that maybe offline. Well, we have run out of time, but I have one more question. So fear not. I always like to ask the same question at the end of all of our conversations, which is this. Is there something that in your life that's so well designed, it brings you joy whenever you interact with it?
Yeah. I knew you were going to ask because you always do, Greg. And I have to say, I struggled to answer the question. And I think the reason I did is because there are so many objects that are in my life that bring me joy when I use them. It's hard to think of just one. So I actually landed on my laptop, and not because it's necessarily the best design, but because I'm using it for so many hours that I have found a way. I've got it propped up on my desk so that it's in my eye height ergonomically. And I've got this keyboard that I figured out how to use, and this mouse, and it's become an extension of me. So for right now, it's this very important tool that brings me joy because it helps me get through the day. So that's my answer.
I like it. I will accept that answer. Luckily for you, I've rejected very few, but this will not be a rejection. I accept that. I love it. Thank you so much. This has been a great conversation. There's so much to learn. I feel like we could go for another hour and a half, but we cannot. So we might have to renew this and have you back in a little bit to talk some more about some of the things that you've done, that storied life of yours. Thank you so much for appearing, and I look forward to all the new exciting things you're going to do in the next half of your career.
Greg, thank you so much. I really enjoy your podcast. I think you do a terrific job, and it's a service to our community. And thank you. It's certainly an honor to be asked to join you today, and thank you so much.
Thanks for tuning in. We hope you enjoyed today's episode. For more on Robert, follow him on LinkedIn. Check back for more episodes of Designing for Health wherever you listen to podcasts or on NordicGlobal.com. We'll see you again next time on Designing for Health. If you enjoyed this episode, please leave us a 5-star rating and a review. This helps others find the podcast as well.